So I will ask the first question actually to Dr. Prakash. I was wondering, I saw that you use a lot of different types of cells, some from metastatic pancreatic tumors and some of primary pancreatic tumors. Do you assume that the stroma is the same in metastasis and in primary tumors? Because I'm not so sure that, let's say, the development of this two is completely different. And for that reason, I'm not sure if you have two comparable systems, which could be also one of the explanations why they find different results in these two studies you showed.
Yes.
No, I think you just have to speak.
Okay. So basically, you know, the metastasis is depending on the stage. So if it's a pre-metastatic niche, it starts from the fibrosis. So what happens? So what happens actually, you know, during the metastasis, there is already fibrosis established in liver and lungs. But in case of bone metastasis, that's not so much case. So it's depending on where the metastasis is. And coming, you know, back to the stroma really varies from case to case. And in the, let's say, the micrometastasis, there is very little stroma. But as soon as the tumor starts developing at the metastatic site, the stroma also grows. And you can find that it becomes like a primary tumor at a certain point.
Even louder.
It's a lot, yes.
Okay, more questions?
Regarding the ammonia concentration, this question goes to Hezi in tumors. I was wondering if this is the case, then we should be able to say, well, if we can measure the tumor concentration of ammonia, we can predict the response to Doxil. Do you think this is a valid assumption?
Well,
technically,
yeah. Well, yeah, ammonia concentration can be measured. We have now two methods to measure it in the tissue. One is a HPLC method that Dima developed, and the other is an enzymatic method developed by Eng. So there are two different methods that are working very well in very good agreement, actually. So the answer is yes, you can. If you get a biopsy, I think you have to do it fresh, because ammonia is a kind of not easy to deal with. If you do it fresh, yeah, you can get ammonia concentration. Then we can answer this question. I think it will be dependent on the ammonia concentration. At least in vitro, it's highly dependent. In tissue culture, it's highly dependent. So I don't see any reason why not in vivo. It will be dependent on the ammonia concentration. You know, we have an enigma with Doxil for many years that we see that in a way there is no good dose response curve. I mean, and I wonder why. I don't think this is the only reason. It can be also distribution in the tumor. It can be many other things. But I'm sure that if you get a lot of it, as we know from cisplatin, I always look upon it as a model to learn about how the system works. Cisplatin in liposome, at least in what we used to do many years ago, Alberto, you remember, did not release the drug. It accumulates wonderfully in the tumor. It showed no toxicity, but no efficacy, and the reason there is no release. So if there is no release, there is no efficacy. Now, we know that if we release cisplatin with ultrasound, the work that Avi Schroeder, that was in this conference, also did many years ago when he was my PhD student, we demonstrate that then it becomes efficacious. So we know that if you release, you get activity. Now what we have to do is really try to see if we can, with ammonia in vivo, get a dose response curve. And I think if we establish this, but you know, the point is that ammonia is toxic. So you cannot, you know, I thought about delivering liposome with ammonia to the site, which is easy to do actually, and get more ammonia, but ammonia may be released on the way, and So I think it's a very dangerous thing. So what we can do, and actually I think there are data that support it very indirectly, not for Doxil, but we have, I don't know, but you know that there is some trends and people discussing a kind of adding more glutamine to the diet of some tumor patients. So I don't know if this, increase the glutamine amount in the plasma, are we going to get more ammonia? Because I don't know what's the metabolic capacity of the tumor tissue. You know, now the utilization of glutamine become a very, very hot topic in tumor metabolism. And there are few recent papers in Nature and Science about it. We started a little bit before this wave of interest. And actually, it showed that glutamine is important for glioblastoma growth, for example. If you deprive the cell of glutamine, they cannot develop. So, you know, so again, giving more glutamine, I'm not sure it's a good thing to do. So very controversial. But I think to measure it and to see if different tumor has different ammonia, does it reflect in the therapeutic efficacy or even in the amount of release in vivo, I think will be very, very good study to do. We learn a lot. Actually, there is another one I collaborated here with Amo Chemi is giving a lecture now with another system of delivery that we collaborate a little bit, and we saw also that ammonia helps there. So ammonia helps in other cases as well, not only in the case of Doxil.
There's one more question, and then I think we have to move in the other room.
On this topic, could it be done in a circulating tumor cell setting with a liquid biopsy? These ammonia concentration studies.
Sure. Yeah, you can measure the production of ammonia, yeah.
Then it becomes localized in a droplet, and you could indeed see it without dispersing it into the tumor.
Yeah, it's a good idea.
Good. So I think you have another project. Thank you for
Okay.
all the...
That's the one thing I'm not lacking.
Okay, this is always like this. We thank again all the speakers, and I think then we have to move to the Montreal room.